Hello and welcome to the Sharp Psych. Communicating effectively with a loved one with borderline personality disorder can sometimes feel like an uphill battle, especially since the disorder is not very known and there are many misconceptions related to it. This is why we chose this video, to understand this disorder better, sort out the facts from the myths, and share practical tips to help you build healthier relationships and improve communication with your loved one. We put together extensive research and will provide valuable insights on navigating your relationships better. So, sit tight and get ready to delve into the world of borderline personality disorder. But first, remember to subscribe and click the bell icon to get notified of any new video that can help you. Also, check out the links in the description for my best recommendations. Now, let's get into it. A small introduction to BPD is a must. So, for those who don't know what it is, borderline personality disorder is a mental health disorder affecting a person's ability to regulate emotions and maintain stable relationships. This disorder affects around 1 to 2% of the population. People with BPD may experience intense and fluctuating emotions, have a poor sense of self-identity, and engage in impulsive and self-destructive behaviors. These behaviors may include reckless driving, substance abuse, self-harm, and binge eating. What pushes a person to this state of self-harm? Good question. However, the exact cause of borderline personality disorder, BPD, are not entirely understood, but research suggests that there are genetic, environmental, and social factors. The primary factor contributing to BPD is genetics. Studies suggest that BPD runs in families and may have a genetic component. However, no specific gene has been identified as the sole cause of the disorder. So far, these are merely speculations, waiting for science to get more advanced to prove or refute them. Second, we have environmental factors that can play a role in the development of BPD. Traumatic experiences like physical or sexual abuse, neglect, or abandonment can increase the risk of developing this condition. Other environmental factors such as inconsistent parenting, invalidation of emotions, or lack of emotional support can also be the cause. Next, we have social factors such as cultural or societal norms. These may also contribute to the development of BPD. For example, a culture that values emotional suppression and stoicism may make it difficult for individuals to express their emotions healthily, leading to BPD symptoms. Also, brain chemistry and functioning may contribute to the development of the disorder. Individuals with BPD may have abnormalities in the areas of the brain that regulate emotions, leading to difficulty with emotional regulation and impulse control. But before moving on to the next part, I want to mention that while these factors may contribute to the development of BPD, not everyone who experiences them will suffer from it. Additionally, individuals with BPD can learn skills for emotional regulation and improve their quality of life with the proper support and treatment. Now that we've gone over some of the leading causes of BPD, it's time to see what the symptoms are. So, let's get through the expected behaviors and experiences that could be identified as BPD. First, intense and unstable emotions. People with BPD may experience severe and dangerous emotions that can shift quickly and unpredictably. This can include feelings of anger, anxiety, sadness, or shame. The next thing is unstable relationships. Individuals with BPD may struggle to maintain stable relationships due to a fear of abandonment or rejection. They may also struggle with trust and have difficulty setting appropriate boundaries. A person with BPD can be identified with impulsive behavior. They often engage in dangerous behaviors such as binge eating, reckless driving, substance abuse, and self-harm. Next, individuals with borderline personality disorder might potentially have a distorted sense of self-identity, leading to emptiness, confusion, and a lack of direction. The constant feeling of emptiness or boredom can lead to a lack of motivation and active engagement. This leads to the next point, which is mood swings. Individuals with BPD may experience rapid and intense mood swings that can last hours or days. All of this, unfortunately, could lead to self-harm. People with BPD may engage in self-harm behaviors such as cutting, burning, or hitting themselves to cope with difficult emotions. Although BPD can cause countless destructive behaviors, this condition should not be blamed for everything. Despite its frequency, there are still many misconceptions about it that exist in society. One of the most common misconceptions about BPD is that people with it are manipulative and attention-seeking. However, this is far from the truth. People with BPD often struggle with regulating their emotions and may have difficulty managing their impulses. As we mentioned earlier, this can lead to impulsive behavior, mood swings, and intense emotions that can overwhelm the individual. But these behaviors are not intentional or done to manipulate others, but rather as a result of the individual's struggles with BPD. Another common misconception about BPD is that it's untreatable. However, many effective treatments are available, and we'll talk about those in detail in a minute. Finally, it's essential to note that BPD is not a character flaw or a personal weakness. It is a legitimate mental health disorder that requires proper diagnosis and treatment. Individuals with BPD often face stigma and discrimination due to these misconceptions, making seeking treatment even more difficult. Another difficulty that people with BPD face, besides these misconceptions that further deepen the suffering, is their inability to communicate healthily. This eventually leads to problems in their relationships. The reason for that is that BPD affects a person's ability to regulate emotions, leading to intense and unpredictable emotions that can make communication difficult. To understand how this happens, we'll review some of the main challenges you may face if your loved one has BPD. The first one is the fear of abandonment. Individuals with BPD may perceive minor conflict as threatening the relationship and react with intense emotions such as anger, fear, or sadness. This fear of abandonment can make it difficult for the person to express their thoughts and feelings openly and honestly, leading to misunderstandings and miscommunications. Another challenge of communication in relationships with BPD is the tendency to engage in black and white thinking. Individuals with BPD may struggle to see the gray area in situations and may perceive things in extremes, meaning things are either all good or all bad. This can make it challenging to communicate effectively, as the person may struggle to understand another person's perspective. People with BPD may also struggle with maintaining boundaries in relationships, leading to a lack of trust and difficulty establishing healthy communication patterns. They may also work to maintain stable relationships due to their fear of abandonment, leading to intense emotions and conflict. But you don't need to worry about that. With the proper support and treatment, individuals with BPD can learn skills for emotional regulation and improve their quality of life. It is crucial to seek professional help to receive an accurate diagnosis and develop a treatment plan that meets their unique needs. However, these are the primary treatment methods used. Therapy is the first treatment for BPD, and several types of therapy have proven effective. Dialectical behavior therapy, DBT, is specifically designed for individuals with BPD and focuses on developing skills for emotional regulation, mindfulness, and interpersonal effectiveness. Cognitive behavior therapy, CBT, is another type of therapy that will help individuals with BPD identify and change negative thought patterns and behaviors. Medication may also treat BPD symptoms, such as mood swings or anxiety. However, medication is typically used in combination with therapy and other forms of treatment. But before trying anything, finding a mental health professional experienced in training BPD is essential. A therapist specializing in BPD can provide the most effective treatment and support for individuals with the disorder. Additionally, support groups and peer support can help manage BPD symptoms and connect with others who understand the challenges of the condition. Seeking help is essential, but you still have work to do yourself. Individuals with BPD can learn to communicate effectively and improve their relationships. To do that, we suggest the following tips. Firstly, it is essential to become aware of your emotions and triggers. BPD usually means intense emotions, and it's necessary to recognize when they are becoming overwhelmed. By becoming aware of your feelings, you can take steps to regulate them and prevent them from escalating. Secondly, practice mindfulness. This can help you feel aware of your thoughts and emotions and learn to observe them without judgment. By practicing mindfulness, you can improve your emotional regulation and reduce the intensity of your feelings. Thirdly, use I statements instead of you statements. I statements focus on how you feel rather than blaming or accusing the other person. For example, instead of saying, "You always do this," try saying, "I feel hurt when this happens." Fourthly, listen actively. Active listening involves focusing on what the other person is saying rather than thinking about your response. Listening actively, you can better understand the other person's perspective and improve communication. In addition, Even if you're not suffering from this disorder, you can still help your partner with BPD by learning simple strategies. First, stay calm and patient during your communication. BPD can cause intense emotions. Not reacting emotionally is vital to avoid escalating a situation. Instead, take deep breaths and try to remain calm and rational. Next, I recommend trying to validate your partner's feelings. Individuals with BPD often struggle with emotional regulation, and validating their emotions can help them feel heard and understood. For example, phrases like, "I understand that this situation is difficult for you," can help de-escalate a situation. Another important tip is to set boundaries and stick to them. Individuals with BPD may have difficulty with boundaries, so it's essential to be clear about your needs and limits. For example, if you need space, communicate clearly and respectfully. In conclusion, effective communication is critical to any relationship, but it can be particularly challenging when one partner has borderline personality disorder. However, by implementing the tips and strategies discussed in this video, individuals with BPD and their partners can learn to communicate effectively and maintain healthy and fulfilling relationships. Be patient and loving towards yourself and your partner. You can surpass this. Thanks for watching, and we hope these tips were helpful to you. Stay safe, and I'll see you on the next one.